Hello and welcome to this year's LSE Health's public lecture. The event's going to be on video and audio recorded and will be available online at a later date for public consumption as a podcast. The LinkedIn and hashtag are for this evening if you want to follow up for those who wish to tweet about the event, hashtag LSE Health. And it's my great pleasure to introduce to you Dr. Sania Nishtar, who's currently the Chief Executive Officer of Gavi, the Vaccine Alliance. Dr. Nishtar is a medical trained doctor, and before joining Gavi, she was part of Pakistan's government, national government, where she served between 2008 and 2022 as a special assistant to the Prime Minister on social protection and poverty alleviation, and then as a role with the status of a senator within the Pakistan government. So she's got lots of political experience, and I'm sure that this talk, which is going to be on what's next for the future of global immunisation and why does it matter, is going to be fascinating. So without further ado, I'll hand over to Sania. Thank you very much.
Thank you very much for the introduction, and thank you very much for the opportunity to be able to speak to all of you and to talk about the future of immunization at this seat of learning. Deeply honored indeed. And today, as I talk about the future of immunization, I'd like to visit the past and the present for a moment. So, as a young girl growing up in Pakistan, I would see people whose faces still bore the scars of smallpox. I would see people who had been paralyzed by polio. The terrible evidence of vaccine-preventable diseases was everywhere. Later on, as a physician, I would treat children who were suffering from pneumonia, malaria, and other preventable diseases. I saw firsthand not only the anguish and pain diseases cause for individuals and families, I also saw the broader impact that vaccine-preventable diseases can have on health systems and societies. And then as a minister in the Pakistani government, I was all too aware of the catastrophic health threats posed by climate change and pandemics. So today, as Gavi's leader, these experiences help to keep me grounded in the realities of the families, the communities, and the health workers of the countries that Gavi supports. These are constant reminders, and these realizations leave us no choice but to succeed in our mission. I just want to emphasize and bring to bear the reality that a world without vaccines is a world living in fear and grief. In pre-modern times, around half of children died of infectious diseases. It's easy to forget that diseases like polio, yellow fever, and cholera used to cause death and disability in countries that are now virtually free of these diseases, largely thanks to vaccines. And let me recall that as recently as 1974, a smallpox epidemic in India claimed 15,000 lives. But thanks to vaccines, smallpox was wiped off the planet just 6 years later. 36 years ago, polio was endemic in 125 countries. Now it's only endemic in 2 countries. Thanks to the widespread vaccination, more than 20 million people are walking who would otherwise have been paralyzed by this dreadful disease. I want to talk to you now about how Gavi, with our unique model based on public and private collaboration, fits into the story of immunization. Vaccines are actually a miracle of modern world. 50 years ago, the expanded program on immunization, or EPI as it came to be known, was launched. This initiative would see every country in the world have its own national immunization program. And since that ambitious launch in 1974, vaccines have saved 154 million lives. But progress towards securing access to vaccines for lower-income countries remained slow until the year 2000. And that is when Gavi, the Vaccine Alliance, was established to address the prevailing serious inequity by ensuring that children born in the lowest income countries have the same protection from preventable infectious disease as children born in high income countries. And we've made progress ever since that. As you'll see in this slide that charts coverage of the three most basic vaccines against diphtheria, pertussis, and tetanus. So this is what a multi-stakeholder partnership looks like, as you can see on the slide. Gavi, the Vaccine Alliance, was established by founding partners, the World Health Organization, UNICEF, the World Bank, and the Bill and Melinda Gates Foundation. From day one, our alliance brought together developing country and donor governments, the vaccine industry, technical agencies, civil society, and the private sector. Allow me to say that Gavi's unique model has been revolutionary. By pooling demand for vaccines from the lowest income countries, we have dramatically reduced the cost of vaccines. We've strengthened health systems to deliver vaccines more efficiently, and we support countries to co-finance their vaccine programs, helping them along a path towards becoming fully self-sufficient. And I will talk about some of these aspects of our model later. I want to talk about our impact now. Since our inception in the year 2000, Gavi has helped to immunize a whole generation, over 1.1 billion children. This huge scale has meant more than 18.8 million future deaths have been averted across 78 lower-income countries. By preventing illness, death, and long-term disability, children are able to attain an education and go on to build careers. And as you are aware, families save money by avoiding crippling healthcare costs when their children fall ill, and economies benefit from a more productive, healthy workforce. But what does it actually mean in practice? We calculated that between the year 2000 and 2023, our work helped generate more than $250 billion in economic benefits in the countries we support. And our work has helped 19 countries reach a stage where they're able to fully fund their own vaccine programs. And that's quite a significant achievement. Back in the year 2000, as you can see from this slide, Gavi offered just 6 vaccines. Compare this to today, when there are now 20 vaccines in our portfolio. I will talk more about our growing portfolio of vaccines later as well. But as we have grown our portfolio, so have we grown the number of children who we have been able to reach. 2023 saw us reach more than 69 million children through Gavi-supported routine vaccinations. And this was more than any year in history apart from 2019. Just trying to move my slide further, just bear with me. The big picture is that vaccines have contributed to a significant drop in child mortality since the year 2000. In the 78 Gavi-supported countries, the under 5 mortality rate has fallen 50% during this time. And meanwhile, the number of vaccine-preventable child deaths has dropped by 70%. What does this actually mean? It means that a child born today in a Gavi-supported country is more likely than ever before to celebrate their 5th birthday. There is no better example of how Gavi drives vaccine equity than the hip vaccine. In the year 2000, when Gavi started supporting the hip vaccine, just 3% of all low-income countries had introduced it nationally, compared with 73% of high-income countries. Since 2014, thanks to Gavi support, all lower income countries have introduced the vaccine in their national programs, putting them on a par with high income countries. Today, this vaccine is one of the components of the 5-in-1 pentavalent and the 6-in-1 hexavalent vaccines, which makes its delivery even more efficient. Friends and colleagues on the webinar, I mentioned earlier that our portfolio of vaccines has grown from 6 in 2000 to 20 today. Indeed, today, Gavi's vaccine portfolio doesn't only focus on children. We support countries to protect adults through outbreak response against diseases like cholera, Ebola, meningitis, yellow fever, and of course, COVID-19. To give you a very current example of how our work is evolving, just to give you a sense, next week we will introduce our very first preventive vaccination against Ebola in Sierra Leone. Up until now, we have only been able to provide Ebola vaccines from a stockpile whenever there has been an outbreak. Today, we have enough supply, which means we can help countries at most risk ensure their health workers and other essential personnel are protected before any outbreak comes along. And this will have a powerful impact for helping contain future outbreaks. I also want to talk about COVID-19. Back in 2020, Gavi helped establish and later co-led COVAX, an initiative to secure equitable access to COVID-19 vaccines for lower income countries. By the end of 2022, COVAX had delivered nearly 2 billion COVID-19 vaccines to 146 economies and averted an estimated 2.7 million deaths across participating low and middle income countries. One important aspect of our model is something we called market shaping. By aggregating demand from developing countries and pooling donor support for immunization, Gavi has been able to create a viable market where one did not exist before. New market entrants, including from low and middle income countries, help to secure supply and increase price competition. And here you can see what our supplier base looked like when we started buying vaccines back in 2001. But through Gavi's market-shaping efforts, the number of manufacturers supplying pre-qualified Gavi-supported vaccines reached at 19 in 2023, and compared to 5 in 2021, in the year 2001. And it's worth mentioning that more than half of these manufacturers are based in low and middle income countries. So this geographic diversity of production that you're seeing up on the screen is also essential in terms of pandemic, as it means every region has access to doses in an emergency. And later I will share with you our plans to expand vaccine manufacturing in Africa, and you must remember this slide when we talk about that. I mean, looking at the slide, what I want to convey is that as immunization coverage increases, there are tremendous economic benefits for individuals, for families, and for countries. A study covering 73 Gavi-supported countries showed that for every $1 spent in immunization in the 2021 to 2030 period, $21 are saved in healthcare costs, lost wages, and lost productivity due to illness and death. But when considering the value people place on lives saved by vaccines, which is likely to include the value of costs averted, plus the broader societal value of lives saved and people living longer and healthier lives, the return on investment is estimated to be $54 per $1 spent on the Gavi programs. This is why we strongly believe that investing in immunization represents one of the best health investments countries can make. I mentioned before that our model is designed to help countries along a pathway to self-sufficiency. This is our ultimate goal, to put ourselves out of business. To bring countries on this trajectory towards financial sustainability and to empower them to take ownership of their vaccination programs, Gavi has pioneered an approach to co-financing and transition. And up on this slide, you see Gavi's co-financing model. So the way it works is that countries share the cost of the vaccine programs by directly co-procuring a portion of the vaccines and safe injection devices from a supplier or procurement agency to fulfill their co-financing requirements. And as the country's gross national income per capita increases, so the level of its co-financing payments also rise. And countries are grouped under different categories according to their level of GNI per capita as a proxy of their ability to pay. And ultimately, they transition out of Gavi support. 19 countries of the original 78 that Gavi started supporting have today transitioned out of Gavi support and are paying for the cost of their vaccines themselves. I want to pause here and talk a little bit about the challenges that we face. Over the years, as we have seen, Gavi's model has been incredibly durable. It has also evolved to support more and more outbreak responses, and it has offered complex vaccinations to people throughout the course of their lifetime. But today, our model is facing new challenges, and I want to talk to you about 3 of them: the climate crisis, fragility in conflicts, and global health security. First, the changing climate disproportionately affects Gavi implementing countries, and it really exacerbates health challenges. Malaria continues to be one of the world's biggest killers, and climate change is helping carrier mosquitoes spread to new regions. In 2023, for example, cases of malaria tripled in northwest Pakistan because of the unprecedented rainfall and devastating floods. And I saw that firsthand because I come from that part of the world. Floods, droughts, and disasters like landslides also disrupt travel for our health workers and make it hard to store and transport vaccines. Extreme weather events threaten sanitation and water supplies. Waterborne diseases like cholera are becoming more common, placing the stockpiles we maintain under constant pressure. And compounding these challenges are rising rates of conflict and fragility. The number of forcibly displaced people has reached a historic high of 120 million in 2024, and this is expected to rise. 75% of the world's refugees are hosted in low and middle income countries. In Sudan, the outbreak of conflict in 2023 meant we had to pivot our efforts to focus on vaccination in regions receiving internally displaced people. And finally, of course, we have lived through the COVID-19 pandemic, and we should always remember that when it comes to the next pandemic, it's not a question of if, it's a question of when. Outbreaks and pandemics are increasing in likelihood in the world's, and as the world's population rises and travel increases, urbanization encroaches into new habitats. So the Mpox outbreak that started in 2022 has now been declared as a public health emergency of international concern, reminding us that in times like these, we can never be safe until we are all safe. So I'm pleased to let you know that Gavi is supporting Mpox vaccination, and beginning 2026, we will establish a global stockpile of Mpox vaccines. All of this demonstrates why Gavi's vaccine portfolio has had to expand significantly over more than 2 decades. There are new diseases to fight and new vaccines with which to fight them. Through routine immunization programs, preventive campaigns, and emergency stockpiles, Gavi now supports vaccines against 20 infectious diseases, including most recently the rabies vaccine. That's the 20th antigen in the Gavi portfolio. One important addition to our portfolio has been the HPV vaccine. Let me recall at this point that last year cervical cancer claimed the lives of around 350,000 women, of which over 90% were in low and middle income countries. Just one dose of the human papillomavirus vaccine is effective in protecting against the main causes of cervical cancer, making it one of the most impactful vaccines supported by Gavi. Think about this in another way. For every 1,000 children and adolescents immunized with the HPV vaccine, we can prevent 17 future deaths. Last year, colleagues and participants of the webinar, we launched an ambitious $600 million revitalization program of our HPV vaccine, and we are making good progress. In 2023 alone, Gavi countries immunized more than 14 million girls against HPV. This is more than the previous 10 years combined and means that since 2014, we have been able to reach a total of 27.3 million girls. We are still ramping this program up, and our goal is to reach no less than 86 million girls by the end of the year. And I'm happy to say that to date, we are on track to meet this objective. I'm glad to let you know that our Vaccine Alliance has also made history in another way this year, helping 16 African countries to introduce the world's first malaria vaccines into childhood immunization programs. Malaria, as you know, is one of the biggest killers of children in Africa, and indeed the disease burden falls heavily on the youngest, with 78% of all deaths occurring in children under 5 years of age. Malaria vaccines were 50 years in development. And indeed, this is the first time we have been able to develop a vaccine to fight a parasite in humans. Gavi played a pivotal role in keeping development programs on track in recent years, and today I'm very happy to be able to say that we have 2 safe and effective vaccines we are able to offer to country. Today, they are needed more than ever before, given the increasing spread of malaria due to the climate crisis, and we hope generations of malaria vaccines will be more effective and perhaps easier to administer, with the current vaccines requiring 4 injections. In our next 5-year strategic period from 2026 to 2030, we will protect 50 million children against malaria. So looking to the future, the pipeline for new vaccines is truly exciting. In the years to come, we could see vaccines against tuberculosis, which Gavi will support for adolescents, and another vaccine potentially against lung cancer, which is the world's most common cancer. Our vaccine investment strategy is a critical part of the Gavi model to accelerate access to lower income countries, so new vaccines can be deployed as soon as they become available. In our next strategic period, beginning in 2025, we will introduce vaccine programs for Group B streptococcus, dengue fever, hepatitis C, as well as Mpox. Over half the vaccines in Gavi's portfolio will help countries adapt to the twin threats of climate change and the silent pandemic of antimicrobial resistance. Despite all of the progress our alliance has made together, I must recall, on a sobering note, there were 11 million children born in lower income countries last year whom we did not manage to reach with even a single dose of basic vaccines. These are unfortunately known as the zero-dose children. Zero-dose children tend to be clustered in missed communities without any basic health services. 5 countries account for just over half of zero-dose children in the world. Nigeria, Ethiopia, India, the Democratic Republic of Congo, and Pakistan. There are lots of reasons why children miss out on vaccinations. Some are part of nomadic communities who are harder to track. Some have been displaced by conflict or natural disasters. So with equity as the organizing principle, the core focus in our current strategic period is reaching zero-dose children. But we can't achieve this with the business as usual approach, which is why we plan to employ innovative tools to reach every child with the life-saving power of vaccines. Paper-based record keeping and inconsistent healthcare provision is in under-resourced or fragile areas, as you know, compounds the problem. It is really easy for children in these contexts to slip through the net and become untraceable. So finding novel ways to deliver vaccinations in these contexts is vital. And this, of course, can include simplifying vaccine administration so that healthcare workers can vaccinate quickly and with limited resources. A part of the solutions also include the use of AI to find hard-to-reach pockets and easy administration tools. We have talked about innovation in vaccines. Now I'd like to talk about just a few of the many innovations in vaccine delivery that will be so vital in helping us reach zero-dose children and making routine immunization programs more efficient and effective. And one such area of delivery that we are excited by are the microarray patches, or the MAPs as we call them. These are vaccines which are delivered by a patch, akin to an adhesive tape, not a needle. This is a simpler method, which is better for missed or historically under-engaged communities. So I'm glad to let you know that trials of MAPs are already helping us to deliver cholera vaccines. And MAPs for measles rubella vaccine could become available by 2030. So MAPs are needle-free, they are pre-dosed, which means that local community members can be easily empowered to use and deliver them in areas where specialist health workers might not be available. And being more compact and lighter than traditional vials and needles, they are easier to transport to hard-to-reach regions. And they are less reliant on cold storage, a challenge in places with an unstable electricity supply. And I've just arrived this morning from Uganda, a country where 50% of the villages do not have access to electricity. So I could really appreciate firsthand what value a technology such as the MAPs could bring. We are very committed to a 5-year action plan to accelerate development of vaccine MAPs, and we are looking forward to attract other global health partners and funders in this effort as well. We have seen positive trials that have highlighted their potential benefits, such as being more acceptable to vaccine-hesitant individuals, and they have shown us the key areas for improvements. I'm sure students at the London School of Economics will be used to learning about how advanced technologies such as artificial intelligence, machine learning, and big data are opening up new opportunities for the global economy. But let me tell you that they are also opening new opportunities for immunization. A fundamental tenet of Gavi's model is its belief in the power of the private sector to unlock innovative solutions, which we can then scale up to deliver better immunization outcomes for countries. So I'd like you to know about the Gavi's Infuse program, which has been up and running since 2016. Infuse stands for Innovation for Uptake, Scale, and Equity in Immunization. And this program has really helped to foster innovation that delivers at scale reducing costs, improving health outcomes, and increasing efficiency across Gavi-supported countries. I will give you some examples of our partnerships and innovations in action. For instance, in Niger, Burkina Faso, and Senegal, Toyota's refrigerated vaccine transport vehicles used AI to reduce operational costs by 63% by improving fuel efficiency and finding faster routes. A digital health platform called mVaccine, supported by Orange, is helping over 100,000 children in Cote d'Ivoire. And big data also helped to reach 140,000 underserved children in Ethiopia, thanks to the Children's Investment Fund Foundation. Also on this slide, you can see innovative finance, and I will come to this later. But one innovation that I would really like to mention, and in which Gavi has helped play a pivotal role in catalyzing that innovation, is the use of drones to deliver vaccines efficiently to remote areas. So here's a closer look at one of Gavi's partnerships that has taken flight. And as the CEO of Zipline, Keller Renardo, puts it, and I quote, "Leveraging capabilities and resources from the public and private sectors to scale innovation is Gavi's hallmark of success. And it has enabled us to deliver tens of millions of vaccines together," unquote. Very humbled to say that today drone delivery is an increasingly mainstream transportation system across our alliance as we continue to roll drones out into new countries. Turning to another innovation, infant biometrics, allow me to say that we have learned from past investments in areas like reaching zero-dose children drone delivery and improving cold chain solutions that creating a competitive environment for ideas helps foster solutions that really work. So in our next 5-year strategic period, we will continue to work with the private sector with a goal to raise $200 to $300 million in additional private sector capital for a new innovation scale-up fund. Partnering with the right innovators is also key. For example, working with Simprints, the world's first open source biometric ID, it's helping us provide 500,000 children in Guyana with routine immunizations and malaria vaccines. Globally, 1 in 4 children go unregistered at birth, which can make it nearly impossible for health workers to track them and ensure they are vaccinated. So Simprints was founded to provide ethical and inclusive patient ID powered by biometrics. Its fingerprint gathering technology is sensitive enough to read the soft and tiny fingertips of the youngest children. Fingerprint registration means a lot to immunization delivery. It means very young children can be tracked, not just by their address, which can change, but by a common name, and not by a common name, but by an identifier that will not change. This has been a game changer for us in helping to ensure children are followed up through their early years and receive all the vaccinations they need to be, that they need to be protective. So coverage rates are fundamental pillars of vaccine programs, but there are so many factors that can skew reported numbers away from reality. That's why there's so often gaps between official figures and survey data. And just one of these factors, duplicate records, is an almost inevitable consequence of the lack of reliable ID. For example, if a name is spelled or incorrectly or a digit in an ID number is switched, service delivery can be delayed or a duplicate record is created. So infant biometrics can really help us navigate these problems. Staying with Simprints and reflecting on this slide, I also want to emphasize that collecting data after vaccination is difficult and expensive. In real time, a biometric is the simplest, quickest, and easiest way to ensure the highest quality, lowest granularity data is captured so that decision makers can verify in real time which services or vaccines are reaching their intended recipients. And mapping these trends against known population demographics enables zero-dose populations to be better targeted, retained in immunization programs. And zero-dose, as you know, is one of the bottom lines that we really want to hit and make a dent in that outcome. This illustrative map shows how Gavi's partnership with Simprints in Ghana and Bangladesh enables their health systems to track how many children are being biometrically identified. With this innovation, the use of real-time and accurate data helps vaccine programs to improve for a number of different reasons. I'm particularly very keen on promoting this area because I have used biometrics in my previous role as the Minister of Social Protection, and I know well what it can do for end-to-end digital processes. So going to another area, artificial intelligence and machine learning. I'm sure you realize that this is one of the most significant technology breakthroughs in recent years. And I'm convinced we can harness its power to improve immunization delivery. Just to give you two examples from the Infuse program, Atlas AI, one of the Gavi Infuse partners, has developed an advanced geospatial platform that leverages AI and big data analytics to identify and locate zero-dose children and missed communities. And it also predicts how climate shocks will affect them. And we're hoping that this will help us plan immunization programs for unvaccinated children and future-proof these plans against future shocks. Another Infuse Gavi partner, Causal Foundries, using AI to tailor immunization activities to individual health workers based on insights like live weather forecasts and outbreak predictions. And we believe this will be of particular use in hard-to-reach or fragile regions where contexts can vary so widely and adaptability on the ground is key. I also want to mention that Genesis Technologies is another Gavi partner, and they're harnessing big data analytics to sharpen the accuracy of vaccine planning to help Pakistan and Mozambique reach under-immunized children. Yet another application of AI that we are excited about is Prompts, which is an AI-enabled SMS messaging service which empowers new and expectant mothers in Kenya with information to navigate their pregnancies, including vaccination schedules. Let me mention here that only 8% of women living in poverty in Kenya can access quality maternal health services, but the AI-enabled chat system answers questions at any time from users, and it is widely accessible. Since November 2023, over 2.5 million mothers have used the service, and expectant mothers can get information on the vaccinations they need, and new mothers are sent reminders of vaccinations for their babies. So we see huge potential in the application of AI and machine learning, but we also face big challenges, as you would appreciate. Our supported countries often struggle with digital infrastructure, with data governance, with joined up data collection and analysis. And we feel that furthering our investment in this new generation of technology will help these challenges and build on the opportunities. So we are also actively looking into how we can deploy AI in our own systems to streamline the work of Gavi, freeing up more resources to improve the impact of our work. I now want to talk a little about Gavi's future. We face a future full of possibilities for advancing vaccine equity. As we have heard, we also face considerable headwinds. And to respond to both these opportunities and challenges, we have designed a strategy for our next 5-year period, which starts in 2026 and is built on 5 pillars. We believe that if we are able to execute our strategy, we'll be able to make our world healthier and more secure by 2030. First, and I'm talking about the 5 pillars now. First, we will protect our world against a growing number of outbreaks, as well as the twin challenge of climate change and AMR. Let's take the recent example of Mpox. Since the start of 2024, the DRC has seen over 4,900 confirmed cases of Mpox and recorded over 629 deaths. And the lessons learned during the Ebola epidemic and COVID-19 have helped us navigate Mpox. Ready and accessible funding is vital to securing vaccines. So in just over a month following the WHO's declaration of the public health emergency, Gavi was able to procure 500,000 doses of the Mpox vaccine for our supported countries, funded by our new First Response Fund. The First Response Fund, and I'm still talking about the first pillar, protecting the world, and within that context, explaining that the First Response Fund is part of our $2.5 billion Day Zero financing facility, which aims to get vaccines to the poorest countries at speed in times of crisis. Our $1.2 billion African vaccine manufacturing accelerator is another concrete action that has been taken as a result of the learnings from the last pandemic. It will provide a longer-term solution to global health security. As we all know, Africa accounts for less than 0.1% of the world's vaccine production, yet it is home to 20% of the population. So AVMA, which has been developed in partnerships with the AU, aims to address this disparity by catalyzing commercial vaccine production in Africa. And we believe that by incentivizing manufacturing on the continent, we hope that by 2035, AVMA will have supported the procurement of at least 800 million vaccine doses made in Africa. But importantly, this will mean that in a future pandemic, the capacity will exist to deliver 700 million doses in a year, which is around 50% of Africa's population. The second pillar in our new strategy is to protect people. So between 2025 and 2030, Gavi will help vaccinate more children against more diseases faster than ever before. This means vaccinating people against 24 different diseases in the lowest income countries in the world, making the coming generation the most protected generation ever. Over 500 million children will be vaccinated between 2026 and 2030, and the number of vaccinations supported by Gavi will increase by up to 1/3 compared with the current 2001 to 2025 strategic period. This will help save over 8 million lives. And of course, we will continue to strengthen our abilities to deliver routine vaccinations to new babies. Here you can see our ambitious goals to deepen coverage of key vaccines. This includes working towards the complete elimination of cervical cancer by vaccinating over 120 million girls against HPV. This will save around 1.5 million lives. So very quickly, as I draw my presentation towards the conclusion, our third pillar is about protecting communities. Here we will facilitate 1.4 billion individual contacts between families and health services. More than ever, our goal of vaccinating the next billion children will see us working across multiple ages, from pregnant women to teenage girls, and we will work increasingly with local partners to help us find the best ways to integrate programs into existing systems. And we believe in this way, we can really work on the zero dose problem and reduce it by 50%. We will also find new ways to reach children in unstable and conflict-affected regions, developing new strategies and partnerships for non-state areas and humanitarian settings. The fourth strategic pillar for the future of immunization lies in partnerships and empowerment. And very much in this vein, we will continue to work with multiple partners, including manufacturers, the private sector, development banks, and other NGOs and charities. We hope this will reduce manufacturing costs and make the production and delivery of vaccines more efficient. We believe that by promoting innovation from manufacturers, we can reduce prices across 50% of our vaccine portfolio between 2026 and 2030. We will work alongside multilateral development banks to increase lending to immunization programming, with the goal of mobilizing at least $1 billion in new bank financing for countries. Let me also mention here that Gavi has been an innovator when it comes to finding new ways of financing our work. One example of our unique record in innovative finance is the International Financing Facility for Immunization, or IFIM as we call it, which helps us access capital from financial markets backed by our sovereign donors. IFIM is popular with some of our donors because it means they can pay down their contribution over a period of time, and it represents 17% of Gavi's overall funding. Finally, our ambitions depend on sustainable and innovative financing model. As I mentioned earlier in this lecture, our ultimate goal is to put ourselves out of business. 15 years ago, just 10% of costs of routine vaccines was covered by Gavi-supported countries. By 2030, we expect this figure to have risen to 40%. We believe our strategy for 2026 to 2030 will unlock an unprecedented $100 billion in economic benefits for countries involved. But of course, we can only deliver these meaningful results if we are able to maintain a laser focus on our own ways of working. And to this end, we expect during the coming 5 years that we will be able to maintain our track record of being able to invest 97 cents in every dollar raised in vaccine programming. So before we move on to the discussion, I just want to share that I returned this morning from Uganda, where Gavi joined President Museveni and our alliance partners in celebrating the 50th anniversary of Uganda's essential program on immunization. Despite the broad range and complexity of our partnerships and programs in Uganda, I came away with something very simple: the power of one drop to change a child's life. Like all essential health services, routine vaccines are an opportunity for a healthy life that no child should be denied, no matter where they live. I believe equity must lie at the beating heart of the future of immunization. By ensuring everyone who needs a vaccine gets one when they need it, wherever they are, we will build a safer, more stable world and a more resilient world. And I'm very optimistic that Gavi's track record in harnessing the power of partnerships and technology, and with that, we can achieve this goal. I thank you.
Thank you very much, Sania. That was fascinating and a very comprehensive overview of Gavi's work. We've got about 10 minutes for questions and answers. We've got quite a lot of answers in the Q&A box, which people can add to, although there are a few already in there. I want to compress a couple of them just to get started and try to get your reactions to what have been a couple of very common themes. I suppose the first thing is, given the success of the Gavi funding and production and delivery model, and your much quoted 21-to-1 rate of return on healthcare costs for vaccines, what do you think are the main inhibitors of further uptake? And in particular, if you could address issues of uptake in areas of conflict, such as the Middle East.
So thank you for that question. Issues of uptake in in all conflict zones are very complicated, because in those areas access is an issue. The traditional the traditional means of delivery are sometimes not working, and we have to work around. We have to find different ways of working in these environments. And because 1/3 of the Gavi portfolio is now related to working in these environments, we've developed institutional capacity for this. So there's a special department dealing with conflict situations and fragile situations. We have a special policy. There's a policy to give co-financing waivers in these situations. We have the ability to jumpstart processes and make decisions very quickly. And as far as the Middle East is concerned, Gavi will provide over 20 million to help immunize children living in Gaza, West Bank, and within Palestinian populations in Lebanon. And the funding disbursed through UNICEF and IFRC will contribute towards maintaining routine and emergency vaccinations, plus access to other essential services such as nutrition. Because in these situations, in addition to UNICEF, which is our regular partner, we also have to mobilize humanitarian actors. So the IFRC is our very trusted partner over there. And I must say that this support comes at a critical time when deteriorating health conditions due to conflict are leaving communities unprotected and vulnerable to the spread of disease. So we were very pleased to provide this support, and we will be announcing support for Sudan and Ukraine in the coming days as well.
Yeah, I think you're right. I think partnerships and collaboration at this time, especially as conflicts grow, is fundamental, really. I want to ask a second question, which has come up a lot. It's kind of unavoidable, I suppose, given your area of vaccinations. What are your thoughts on policies to address vaccine hesitancy and anti-vax sentiments? How do you think we should overcome these?
So I think that the answer lies in being very truthful, because there is some disinformation about vaccines. And I think it's important to bring to bear the fact that the vaccines area is a highly regulated sector. Vaccines undergo a lot of quality control, that their adverse effects are monitored very carefully. And it's important to relay this message. I was in Uganda, as I mentioned several times over the last 2 days, and this was the top theme that came across. The Ministry of Health was very keen for me to convey as a third party to the media, to individuals, that these myths need to be busted. But I have to say that the noise is disproportionate. The noise is actually disproportionate to the actual level of the problem, because it is far more sensational to harp on controversial things than it is to celebrate good news. I've served in the government, as you know, and I recall that as incumbents, we used to do 100 good things, and the media would never be excited. But you make one slip, or one area where they'd find a loophole, and you'd be on the newspapers, you'd be making headlines everywhere. So I think the vaccine hesitancy is somewhat in that camp as well. And I think there's a bit of a paradox here, because I'm just out of a board subcommittee meeting where we were discussing that we have more applications from countries than we expected, which is actually a very good thing. There's a great demand from countries. But then a small coterie of anti-vaxxers will whip up such a storm on social media. And unfortunately, this is the day and age of social media where rather than the truth and evidence, lies and misinformation get a lot of traction. But I have to say that wherever I've been on the ground, communities value vaccination, and governments have great appetite to put in applications.
Yeah, I fully agree with all you've said. Couple of other questions which have come up in sort of compound. Basically, one set of questions have said there's a kind of tendency to think about Gavi's role in low-income countries, missing out middle-income countries in particular, and how do you think that perception may be changed, especially as in some of the middle-income countries, the immunisation rates among some groups are low?
Well, actually, Gavi does have a middle-income country strategy. And as part of that middle-income country strategy, we provide catalytic support for vaccine introduction. And we also provide support for countries that are backsliding. We provide step-up support for them to come to the baseline levels. So there is support for middle-income countries.
And maybe we've got time for one or two other questions, I think, before we have to close the event, unfortunately. But there's been a couple of questions about the recent surge in measles cases globally and attributing that to declining vaccination rates and whether Gavi has specific policies to address that as a specific disease area. People asked about other disease areas, but this was the one that commonly came up, the measles.
So I think as far as the measles outbreaks are concerned, we always say that measles is a canary in the coal mine. Whenever routine vaccination stalls, these are the chinks in the armor. So strengthening routine immunization through the introduction of a second dose of measles-containing vaccine is very important. It's also important to implement timely quality preventive campaigns to further reduce the risk of outbreaks. And I must tell you that in 2024, Gavi is supporting governments, communities, and partners to roll out preventive catch-up and follow-up campaigns to reach up to 100 million children with measles-containing vaccines in 24 countries. And Gavi vaccination efforts in 2024 have also been boosted through Gavi board approval of 290 million in funding for what we call the Big Catch-Up. And the Big Catch-Up initiative basically evolved in the COVID-19 context because countries focused on the delivery of COVID-19 vaccine, and for a time being that was a setback for routine vaccination. So in response, Gavi rolled out what is called the Big Catch-Up initiative, and it is focused on supporting countries to close the immunity gaps created because of the disruptions of that time. So to summarize, the timely preventive campaigns and of course the routine campaigns, as I mentioned initially.
Another set of questions goes back to the hard-to-reach populations and what's happening within Gavi to ensure that peoples like migrants, refugees, and displaced groups generally are being included in your ongoing efforts?
Well, as I said in response to your earlier comment, we do have a dedicated policy, which is called the FED policy. We work with displaced populations. And as I said earlier, we have a dedicated department that works with them. We have special partners who have the ability to reach out to them. We have dedicated funding for these populations and for providing vaccines. So both the internally displaced populations and externally displaced populations are very much part of what we focus on and who we deliver to. And in our parleys with governments, and going back to my discussions on Uganda, The Ugandan government explained to me how there were different pockets of refugees across different borders and what strategies they had brought into play to address them.
So partly shifting away from the populations being serviced, but back to production really, a number of people were asking about the vaccine storage issues in maintaining efficacy, particularly, you touched upon it yourself in your talk, but particularly in low and middle income countries and how you're addressing those issues.
So you require a cold chain for vaccines, and one of the funding priorities for Gavi is building capacity for the cold chain. We have a program which is called the CCOP program, and Gavi has played a very significant role in helping countries invest in warehouses, provided catalytic funding. I think there are thousands of refrigerators and freezers that Gavi has provided. More recently, we've started providing freezers that are solar powered. And sorry to be bringing in Uganda for perhaps the fourth time into the conversation. Uganda is a country where 50% of the villages do not have access to electricity. And let that sink in. 50% of the villages do not have access to electricity. But in that country, the coverage of the human papilloma virus vaccine is 99%, and the coverage of DPT3, the childhood vaccines, is 91%. How have they achieved it? It is because of the investments Gavi has made. And Gavi is increasingly investing in solar-powered refrigerators in countries like Uganda, where access to electricity is a problem. We are also solarizing facilities in Africa, and we've just started doing that. So more broadly, Gavi has a funding pipeline that invests in health systems more broadly, but in terms of storage, which is what your question was about, it is the investments in cold chain equipment and the facilities that have been truly transformative in implementing countries. And as a new incoming CEO, I always make it a point whenever I'm on a country visit to see these facilities firsthand. And the Ugandan infrastructure, the infrastructure in Cote d'Ivoire, for instance, state of the art by all standards.
Okay, so again, shifting a little bit in terms of focus, some people have been asking about the role of follow-up data and how you alluded to this during your talk, but how you can collect better follow-up data to see how impactful your programs are actually being in specific localities, and how you can better link interventions to performance and compare the delivery channels. So these set of questions are really about how the follow-up, whilst you're doing a lot at the front end, how the follow-up data that you're trying to collect and gather can help you better target.
So of course there are as far as data and monitoring and remedial action is concerned, there are different layers. Countries conduct population-based surveys that are third-party, that are independent, and as a result of those population-based surveys, we, on a periodic basis, we get to see information at an outcome level, at an impact level. Short of that, Gavi has made several investments very significant investments in bolstering the district health information systems, where immunization metrics have been introduced. So there are service statistics that we have access to as well. And then, of course, internally we have our own ecosystem of tracking metrics. Gavi has what is called the balanced scorecard system, where we assign traffic lights to different indicators that we measure, and there's a whole ecosystem of monitoring that that has existed for quite some time. But as a new incoming CEO, I have added my own style of monitoring to that. We track initiatives. We track them through what is called a delivery unit, a delivery cascade, where milestones are tracked, where a specific metric needs to be tracked. There's a monitoring mechanism for that as well. And of course, on the ground, in humanitarian settings, because you referred to that a couple of times, and I'm sure that the audience has a particular interest in that area. In humanitarian settings, we do that with our partners as well. And we do a lot of data triangulation on the ground to track missed out children, zero-dose children, areas which are inaccessible. And there's a whole infrastructure in place to track outcome metrics, to track management metrics, with the view to solving different problems. And there's a whole cadence of review meetings within the organization to be able to bring to bear reviews to logical conclusions.
Two other related questions, I suppose, about the localities and the support you get there. One is how Gavi works with public health systems generally, and given that public health in particular was stretched through the COVID-19 pandemic, are there any problems that arise with local public health structures in trying to roll out your programs? Was one set of questions. And another, well, let's stick with that first. I'll get to probably the final two questions after that.
So on the ground, we work with government and we work with the alliance partners. And as far as routine vaccination is concerned, we work through the government systems. And as far as the vaccination campaigns are concerned, we also work with government systems. So we use the government reporting systems. We use their vaccinators. We provide funding into their streams. When money goes to our alliance partners, which are WHO and UNICEF, they have an inextricable relationship with government. We use government healthcare workers. We use the government supply chain. The warehouses that we invest in are theirs. The logistics and information management systems that are used for vaccination are all public sector. And of course, there are difficult settings, humanitarian settings, where we have to leverage the outreach of our partners. But by and large, we work with government systems and government public health systems.
Yeah. Okay. So then another set of questions was how does Gavi respond to new diseases as they break out, and which may be on the rise as associated with climate change? Again, you alluded to some of these problems in your talk, but there was a set of questions on how responsive and how quickly can you be responsive to new diseases?
So it depends on what disease we're talking about. So if there's a disease outbreak and the pathogen is known, and the vaccine is in our stockpile, the vaccine for the disease is in a Gavi program, and we have a stockpile. There's a mechanism of mobilizing the stockpile. If, for instance, there is a disease outbreak and the vaccine is not in our stockpile, is not in our program, but the vaccine exists in the market, and Mpox was a case in point, there is a mechanism which comes into play, and we're able to directly order the vaccines to respond, which is what we did in the wake of Mpox, and I explained how the first response fund was invoked. And if the disease outbreak happens and the vaccine is neither in the market nor in our stockpile, but is in the upstream stages of development, that it isn't very much a Gavi role there. There's another sister agency called CEPI, which comes into play. And if, of course, a disease, if the pathogen is not known and there is no vaccine, the example is COVID-19, there, then a COVAX-like mechanism was brought into place. So depending on the scenario, Gavi has different roles. But I must mention that during climate change, in events like floods, we have to pre-position vaccines, and we've done this successfully in Somalia and in Pakistan, for instance. When the floods happened, we were able to pre-position the typhoid vaccine. This has been done in Somalia as well. And of course, the preventive cholera vaccine has a huge role in these settings as well. So depending on the situation, depending on the disease, depending on whether we have the stockpile, whether the vaccine is in the market, where it is in the phases of development, we have different roles that come into play.
Okay, thank you. We've still got a little bit of time and the Q&A is still open, but I think we've covered most of the types of questions. There was maybe a last set of questions which essentially, paraphrasing here, say, this has been very inspirational. Thank you very much for the talk, but how can we help as individuals promote Gavi's activities? As students and others, I presume, just as individuals?
I think as students, as individuals, as responsible citizens, as highly qualified academics, I think you should help dispel these misconceptions against vaccines, which have compounded ever since social media has taken root and fake news has become a new norm. And this fake news, by the way, is not specific to vaccines. It cuts across so many other societal issues. And I think this is a time for truth and reason and evidence to bring to bear. We're talking about children's lives. We're talking about averting disease, death, and disability. There are cost-effective tools. There is a multilateral system in place which is working very well, which is bringing vaccines virtually at very little costs to countries, and making the money available to gear up systems to deliver them. And it's really tragic that somebody will whip up a storm totally on ill-founded basis. So we want you to be involved. We want you to be champions of immunization, and we want you to partner with us for the sake of the lives and health of children all over the world.
Very wise words. As I say, I think we've covered all of the questions, and that really just leaves it to me to thank you very much on behalf of the audience. This will be publicly available at a later date, so we can go over and go back to your words at some later date. And just thank you very much, Sania, for your talks today, and many thanks for joining us as a virtual audience. And hopefully Gavi will prosper and succeed even more in the future. So thank you very much.
Thank you very much. It was a privilege being at your forum.
Thank you.